Welcome to Sunday's update. Now, in Europe, things are definitely going in the wrong direction. In Australia and New Zealand, I think they're going in the right direction. And we will be thinking about the United States later on. For now, let's just say it's a little more complicated. But globally, things are increasing. The pandemic is increasing globally. So 200,000 new cases a day is the global increase. Well over 21 million people infected now. And of course, the death figure only continues to increase. Now, New Zealand are ahead of us. So 13 is today's figures. That's Sunday's increase in New Zealand. Saturday it was 7, Friday it was 13 new cases. The overall number of cases isn't so important because most of these were older. So active cases now in New Zealand, 69. And all of these are epidemiologically linked to the Auckland cluster. So 13 new cases today. Now, of course, these are being actively tracked and traced by the New Zealand authorities. And overall, I suspect very strongly it's going to work. I think they can get rid of this again in New Zealand. After that, it's going to depend on whether there's reinfections again from other sources. But this particular outbreak, I do suspect they will get it under control. So that's the situation in New Zealand. Now, Australia, things are fairly hopeful as well. At least they're certainly heading in the right direction. So New South Wales, the Sydney area, just 5 new cases in 24 hours. Now, Victoria, Melbourne area, of course, 5th of August, it peaked at 725 new cases in a 24-hour period. That's now down fairly consistently to this kind of range, and that was the figure for Saturday, 279 new cases. So I think there's cause for optimism in the Antipodes. Let's hope it keeps going in that direction. Now, Europe, I'm going to give a few examples from Europe. Basically, cases are going up everywhere in Europe, pretty well everywhere I think in Europe at the moment, largely driven by social activities, holidays and young people. Good thing about that is less people are being hospitalised at the moment because young people are proportionately less hospitalised, of course. But a few examples of that, just to put real numbers on it. Now, Ireland, a low population, 4.9 million, 200 new cases in the past 24 hours. Deaths are up to 1,700. But bearing in mind that the population is only 4.9 million, these aren't particularly small numbers. And it's the highest daily increase since May. So that plus 200 was the highest daily increase since May. So definite acceleration of infections in the Republic of Ireland. Multiple clusters across the country. Now, if this was one cluster, as in the case in New Zealand, I would be more optimistic. So the reason I'm optimistic about New Zealand is that although there's different parts of the country involved, it's all this Auckland cluster. Whereas in the Republic of Ireland, they have multiple clusters across the country. Makes it harder, altogether more complicated, means community transmission is occurring. Well, it doesn't definitely mean that, but community transmission is occurring. We do know that from other sources. So secondary spread is going on from these clusters. Localised reimposition of some restrictions. So Ireland is going the same way as basically the rest of Europe, certainly the UK, with a localised response to the increase in cases, which makes a lot of sense. But highest cases since May in the Republic of Ireland, so not encouraging by any means, but part of what we're seeing in Europe generally. Now moving towards the eastern side. Turkey, highest increase, 1,256 new cases, highest increase since June. Death rate not massively increasing, but of course we always have this long lag, don't we, that we're so familiar with now. Now, they lifted a partial lockdown on the 1st of June and they plan to reopen schools next month. Now, I'm kind of coming to a conclusion about schools. It seems to me that schools going back all around the world are going to be a massive driver of infection. And there's information from the States that I believe is supporting that. The States, the terms there seem to start earlier. So in a sense, we're looking to the United States as a as almost an experiment, really. It's predicting what's going to happen, and it's not looking particularly brilliant at the moment. So I tend to think there's going to be hard decisions have to be made all over Europe and all over the United States on schools, but more evidence on that later. We won't jump to that now. Malta has been a good example of how not to do things. Small population, just over 500,000. First case was on the 7th of March. Mid-July, they had 8 days with no cases. Now they've got an increase of 72 cases, which is the highest ever one-day rise. So very unfortunate the way things in Malta have worked out. And there's certainly organisational and there's a lot of pressures on the way things have gone in Malta from influences that haven't been always altogether helpful. Highest ever one-day rise. It's been increasing for the past three weeks. Infections due to more summer gatherings, which have almost been encouraged in some instances. 9 deaths altogether in Malta so far, but that will rise because of the lag effect. Restrictions were lifted in May. There's a backlog of appointments for antigen testing, so they've got problems with testing. 12 European countries have removed Malta from their safe travel list, and some Italians have got cases after returning from Malta. So having done so well in the early stages, it looks like Malta is completely hashed up there, because Malta's a bit like New Zealand. It's an island. It's an island in the Mediterranean, and islands are in an ideal position to stop this pandemic, but it seems that Malta has not done so. So that's unfortunate. But having said that, it's following the European trend. Greece, I'm afraid, is similar. 251 new cases on Friday, 230 new cases on Saturday. 27 from international arrivals. You see, Greece, you can understand this. Greece depends on tourism, but it's been a problem. Sharp increase in cases in Greece in August. Now, the 21st of April, Greece had 156 new cases. 156 new cases. So that was at the peak of the April part of their epidemic, part of the pandemic. And now we can see that cases are well above that now. So the new cases now are higher than they were in Greece, considerably higher than they were in Greece way back in April. So the problem in Greece now accelerating more rapidly than it was in April at the height of the European wave. There's some restrictions from Monday, but they're not pretty draconian. They're just closing pubs from 12 o'clock till 7 a.m. in the morning. So but that's the response. France, likewise, part of the European trend. 2,846 cases on Friday, 3,310 cases on Saturday. Now, interestingly, the French authorities are publishing data on clusters, which is very useful. So they've had 17 new clusters. That gives a total of 552 clusters throughout France. So that's very useful to actually try and quantify the clusters. It really helps to follow the pandemic. But now what it means, there's a lot of clusters in France, unfortunately. Hospitalizations not rising dramatically. Now, hospitalizations had been falling in France for some time. Now I think you'd have to say they've levelled off. So these new cases are probably now starting to feed through to hospitalizations. And of course, they're going to feed through to infections in older people, leading through eventually to deaths in older people as well, largely transmitted to them by the younger people through socialisation activities. So modest increase, 29 new cases in hospitalisations, 9 new cases to intensive care. So modest increase, nothing the French medical authorities can't easily cope with. But nevertheless, the downward trend has now stopped and it seems to be going up. So given this huge amount of new cases we're seeing in France now, it is quite inevitable, absolutely inevitable, that in the next week or two, hospitalisations and intensive care admissions are going to rise. These are going to feed through, that they really can't do otherwise. Paris expanded zones of mask use and mandatory outdoors in a lot of places. Doctors in France calling for masks in the workplace and all indoor spaces, because at the moment it's only mandated in shops. So good to see that French medical associations are taking a lead in that. Spread mostly in younger people, as we've looked at extensively in the last couple of days. So France is a good exemplar there, really, of the problems in the what I am now really, well, I am describing it now as a second wave in Europe, because there is a sustained increase in cases. I don't really care to call it a second wave or a continuation of the first wave. The point is there's a sustained increase in cases. Has been for the last 2 weeks in Europe, and it's throughout Europe. And this could mean that there's a lot of cases ready for the bad weather starting when we expect things to get worse again. So I'm not too optimistic about the coming winter in Europe, because we won't have a vaccine by the coming winter, and cases are increasing, it would appear, already. So I do fear problems to come this coming winter in Europe. Now, the United States, always interesting, always difficult to fully assess. Cases have been increasing at this kind of level for some time now, so well over 5 million, 5.3 million cases. Deaths 169,300. That's actually the New York Times figures. The Centre for Disease Control figures are a little bit behind that. Now, Centre for Disease Control, their kind of announcement and assessment of the situation this week, they've said laboratory tests positive for SARS coronavirus 2 have continued to decrease nationally since mid-July. So here we have the Centre for Disease Control unequivocally announcing that cases in the United States are declining. That is not presented as a hypothesis or something to argue about. They are stating that. Decreased or remains the same depending on the area. So in some cases, in some areas, geographical areas, cases have remained the same. In most cases, in other areas, they've decreased. But overall, nationally, continued to decline nationally since mid-July, is their statement. Weekly hospitalization rates and mortality attributed to COVID-19 declining during week 32. That's the week ending the 8th of August. So hospitalizations and deaths going down in the United States. Again, definitive statements from the Centre for Disease Control. Click on that, it'll take you straight to it, and you'll read exactly the same thing. Mortality attributed to COVID-19 remains above the epidemic threshold, however. So they're still saying there's an epidemic. Now, what do we make of this? Well, this is the Centre for Disease Control, and they're saying cases are going down. So to argue against that, we'd have to have pretty good quality data. And the New York Times data also indicates a reduction, if not as steep a reduction as the Centre for Disease Control. So we have to conclude that cases in the United States are going down. Now, this is remarkably good news. The public health measures in the United States, basically based on those ones, are starting to work. Great. Let's hope it continues. It's encouraging. Now, Georgia. Just got a quick message. In English, we have a saying: "If the cap fits, put it on." Do you have that in the States? So, you know, if this applies to you, take it and own it. If the cap fits, put it on. If that applies to you, and if you live in Georgia, I think you know exactly what I'm talking about. Now, the White House task force has actually called out Georgia. Measures not enough to prevent widespread and expanded community viral spread. So the White House task force is here publicly, as I read this, telling off Georgia for not taking enough preventative measures. And the governors opposed mask mandates, and I think there was even a legal case or something, was there? Governors being opposing mask mandates. So if anyone's watching and the cap fits, do put it on. it's amazing. It's amazing. I mean, my job's not to be in any way political, but don't people realise this is going to be their it's going to be their ass, isn't it? I think that means this is going to have repercussions which have got significant implications for future employment opportunities and political status. It seems to me that the COVID-19 pandemic and the handling thereof is going to determine the next elections in the States. I don't see any way around that. And anyway, yeah, it's got significant implications for the future. Now, having said that, I think Georgia is starting to get its act together now, so that is encouraging. But of course, they've come to the party late. Now, getting onto the schools issue again, at the risk of becoming a bit tedious, but things are starting to unfold a bit now. Clusters in schools and colleges around the country is a fact. That there are clusters around the country. College students having parties and mass gatherings and other forms of social activity upon return to college. And that's generating clusters around the country. American news outlets list them all. I'm not going to go through them all now. But they are there around the country. Now, in Arizona, teachers seem to have, in the UK, in English, they say pulled the sickie. They seem to have gone off sick or something and not going into work. So teachers kind of voting with their feet there in Arizona. How widespread that is, I don't know. Now, the Centre for Disease Control, infections in children. Now, this is a fascinating new document. I might actually do some more work on this at some point because it's interesting. So, just a quick pre-say of it for now. Numbers and rates of cases steadily increasing from March to July 2020 in children. But the real incidence is not known. They don't know. Not enough testing to know. So here we have the American Centre for Disease Control saying they don't know the incidence of infection in children. Not knocking that, I can understand why that is, but still, they don't know. Now, 0 to 17-year-olds are 22% of the American population, currently risen to, and this is an increase, 7.3% of all cases. Of course, many children will be asymptomatic or minimally symptomatic and therefore will not seek testing. Hospitalization rates in children thankfully remain significantly lower than in adults. So the main takeaway message there is the number of cases and the rate of increase in children has been steadily increasing from March to July. But now, of course, with schools going back, I'm afraid I anticipate that is going to greatly accelerate. And we are already seeing that because of the clusters in schools and colleges around the country. And I'm afraid I'm going to predict that there's going to be many more of these. My prediction at the moment, given what I understand, is there's going to be many more of these. Now, people were saying that there's reduced transmission in children. It looks like that's going to be largely relegated to the history of wishful thinking. Because, let's look at some more data though, let's not speculate. So hospitalizations in children are lower, that's good. This is the CDC again. It is unclear if children are susceptible to infection compared with adults. So the CDC are saying they don't know how infectious children are compared to adults. Now, this is not old data. I read this morning about an hour before we're recording this video. They're saying they don't know. Now, I suppose you have to admire their honesty. They're saying they don't know, which is good, rather than making something up. But at the same time, it's they've had quite a few months now. Yeah. And they are the Centre for Disease Control. So anyway, they're saying they don't know. They don't know if they can transmit the virus as effectively as adults. Now, I'm not as well as informed as the Centre for Disease Control, but I don't see any reason why children shouldn't be as susceptible to infection as adults are. And I don't really see any reason why they can't transmit the virus as effectively as adults do. We know, and this is what the CDC reiterate, we did this on this channel last week, I think it was, in quite a lot of detail. Children have the same viral load as adults in the 5 to 17-year-old category. In children younger than 5 years old, 0 to 5 years old, they had much higher viral loads than adults. So the CDC here is confirming that children have the same or higher viral loads than adults. Children can spread the virus effectively in households and camp settings, as we know from epidemiological evidence. They do spread it. So why should schools and colleges be any different from camps or the home setting? You know, I was saying yesterday, we really need to improve the ventilation in educational establishments. And lots of people have wrote to me and said, well, you can't open the windows, they're all sealed. It's just incredible. You can't open the windows and doors and have a through draft. So how can you dilute the viral load? The very infrastructure of the buildings is almost as if it's designed to encourage cross-infection within the building. Quite what you do about that? Well, I suppose you build better buildings in the future, but this modern trend for hermetically sealed buildings is not conducive to infection control, as are older buildings where you can just open the windows and have a draft. It's not that complicated, really, is it? Anyway, that's where we're at. Community mitigation measures and school closures, therefore low transmission so far. So the CDC here are saying there's been community measures, schools have been closed, therefore the infection rate in children is still relatively low. 7.3% of all cases, despite being 22% of the population, but it has been increasing for some time. And to me, it's obviously going to increase with the return to in-person classes. Slightly better news. Food Drug Administration. Yale School of Public Health have got a cheaper saliva test. Now, I think this was tested on basketball players and staff, and it seems to work. In fact, basketball seems to be a big thing in the States, and I think this basketball association paid for it. So that's good. Now, the reagents cost $2 apparently, so the test shouldn't be any more than $10. If it is, I would suspect there's overcharging. So that's encouraging, a saliva test, a cheaper saliva test. Now, that's actually the 5th saliva test approved by the FDA. So let's hope this is a really good one. Takes off. This sort of saliva-based, non-invasive, cheap testing could be a complete game changer. Let's hope that takes off. Now, so yeah, we've got bad news from Europe, good news from the Antipodes, good news from the States in that things are going down now. Unfortunately, I am now predicting that there's going to be a dramatic increase of cases in the United States as a result of schools and colleges going back to class. Now, and of course, that's got huge implications for school openings all over the world. We believe we're nowhere near herd immunity yet in children, so that is probably going to be the world's greatest transmission driver, certainly in the United States and in Europe, in my view, over the next month or two. Let's hope I'm proved wrong on that. But that's my understanding at the moment. I am very concerned about that. This has got potential implications and that could make more cases in the community. And that's exactly what we don't want at the start of winter. Exactly what we don't want. Now, I've prepared this, so I might as well give it to you anyway. The mystery that is South Africa. Now, I've been in email contact with quite a few people from South Africa, and none of them will come and do one of my interviews. It seems they're all frightened of political repercussions. Now, if I'm wrong and you're in South Africa and you're prepared to do a frank interview with me, write to me, I'll do it. But nurses and doctors don't seem to want to talk to me. Even ordinary members of the public don't seem to want to talk to me in South Africa. So what is going on there, I don't know. There is a long history of incompetence and frank corruption in government. I'm not in a position to comment on the current government, but it does appear that, from my personal experience, people don't want to talk to me for fear of repercussions. If I'm wrong, let's get someone from South Africa on if they can talk freely. But I'm not optimistic given what I've tried to do over the past few weeks. Anyway, rather than me speculating what's in the news, Cyril Ramaphosa is saying that South Africa has reached the peak of COVID-19 infections. Let's hope he's right. They do appear to have been going down lately. I have had some emails from concerned citizens, several emails from concerned citizens in South Africa saying it's wrong, saying the official figures are completely inaccurate. They're anonymous. I have read them out on the channel. I can't tell you who they are. I do know who these people are, but they have asked me not to name them. So quite a few people are saying the official South African figures are wrong. I have no way of checking that. I live in England, not in South Africa. So if anyone in South Africa wants to correct me, then please do so. Officially, the cases are going down in South Africa. And Cyril Ramaphosa is celebrating that. Sweeping removal of lockdown restrictions on the economy. Is ending the ban on alcohol and tobacco. Allowing restaurants and taverns to return to normal, albeit with hygiene measures. Removal of the ban on travel between provinces. Maintenance of hygiene measures. Maintaining restrictions on international travel. So the bottom line is I don't know what's going on in South Africa, and I don't think you do, because I'm not sure we're getting good data from South Africa at the moment. If it turns out that I'm wrong, I'll be first to come back on and correct that. Okay, I did drag on a bit yesterday, so apologies for that. Hopefully this is a bit shorter, and enjoy the rest of your Sunday and the start of next week.